Hi, I am going to do my instruction on how I would do a breast exam. First, I would make sure my patient ideally would be 5 to 7 days post-menses. I would just have her sit there or lay there, look at her breast, ask her if there had been changes in her skin, contours, ripples, symmetry, any changes that she noticed, and then I'd notice those changes myself. I would have her arms at her side and look and see how they looked. And then I would put her hands over her head, see how they looked, and on her hips. And then lastly, I would have her lean forward so I could see how they hung and see if there was any pulling or anything like that. I would inspect her breasts, her areola, and her nipples, all for appearance, surface characteristics, color, bilateral pull again, symmetry to see if they were symmetric or not, if there were any jagged edges or strange rashes, color, lesions, and bleeding. So I would note that all in my inspection. And then I would have her lay back, and I would have her lay supine with her shoulder and back. First, I would have her lay like this. Second, I would have her lay like this, or I would instruct her to do this herself at home while she was laying down. And I'd use my second, third, and fourth fingers, and I'd go in a vertical strip pattern, going up, down, up, down, up, down, and make sure that I got all the way over to here, and make sure that I hit the tail of Spence, which is up here. I would do that laterally with her. Again, laterally with her hand up, medial with her hand by her neck. And then what I would be palpating for when I did the vertical strip pattern is consistency, tenderness, pain. I'd obviously be wearing gloves, and after that I would palpate her nipple to assess for discharge, thickening of the nipple, loss of elasticity, and also with the breast and the nipples I would be noting that they were equal temperature, not unusually warm on one side or cold on the other. And then after I did the breast exam, I would inspect her axilla for color, rash, see if there was hair there or if she shaved, and feel if there were masses there. And I would feel around the nodes to see if the nodes were inflamed. And then if I did find findings either under the axilla or on the breast, I would document those findings, and I would be using like the face of a cloth, saying it was at like 12 o'clock, 3 o'clock, or I would divide the breast into 4 quadrants and talk about the upper quadrant or the lower. And then in men, you could also do the same test because men do get breast cancer. It's not as frequent. And you would also note if they were obese, and men who are obese can have large breasts, gynecomastia. So then we go on to the male testicular exam. We want to have them check their testicles, or we would check their testicles, ideally after a warm shower or bath. That helps to relax the scrotum. We would look at the testicles and the penis for swelling, redness, lesions, and then to instruct them how to test or check themselves. They would put their fingers, I don't have anything to demonstrate, but they would use their thumb and their forefingers, and then they'd feel on each side of the testicle. They would palpate, roll the testicle in between their fingers or cup it. If it's not the same size, that's okay, because they're not necessarily going to be exactly the same size. They'd be feeling for lumps, tenderness, thickening, pain, and then they'd go back underneath the testicle and feel back for the epididymis and palpate that. And again, feel if it's tender, if they feel any unusual lumps or anything like that. If they do find lumps, they obviously want to tell their doctor. Takes about 30 seconds to do, and it can save lives. So again, with the skin, we're just making sure there's no rashes or lesions or discharge, and they want to do the same thing. And that's how I would instruct them to do a testicular exam, and how I would instruct a female or to do a breast exam myself.